Welcome in today. I'm so glad that you came back for a follow-up to see me, so we can discuss everything that happened and some future things that we can do. So I understand that you and your partner are not interested in having any more children. Um, so we can talk about what options are available for you that may include hormones, non-hormonal methods, permanent methods of sterilization, or any natural methods that we can try. So first, want to assess how you're feeling to see, if you're healing well from your procedure. So I want to make sure that you're not having any pain, any tenderness. Your bleeding has kind of slowed down or tapered off, and you're not passing any clots. You don't smell any type of foul discharge, or not having any type of foul discharge or any foul bleeding smell from your bleeding or lochia. And you don't have any fever or anything like that. So now that we've got all that cleared and we know that you are healing well and everything seems to be progressing beautifully, let's talk about what your options are. So, permanent sterilization. We can talk about a tubal ligation. Tubal ligations are performed as an outpatient procedure now, laparoscopically. And require about 3 to 4 weeks of recovery. This would mean they would actually cut and cauterize your tubes instead of tying them off like they used to do in older procedures. But it can also cause issues with your menstrual cycles. Lots of after effects of that procedure include heavier periods, more painful cramping, and it has a failure rate, but it only has a failure rate of less than 5%. So that's an option for you. But if you don't want to go the surgical route, we can talk about hormonal versus non-hormonal contraceptives or birth controls. So hormonal oral contraceptives include birth control pills. So we can, if you would like to go that route, that's something that we can explore and see what options would be best for you. You can do a monophasic birth control, or you can do a triphasic birth control, which means monophasic just means that it's the same amount of hormone that's flowing through your body every day of the month. Triphasic means that the hormones in the actual tablets that you're taking, the contraceptive that you're taking, kind of fluctuate throughout the month based on where your cycles are. Where you are in your cycle, I should say, in the month. I'm sorry. So those are your oral contraceptive options. You also have options such as an IUD. They make two different types of IUDs, hormonal or non-hormonal. The hormonal IUD lasts about 5 years, and you can remove it at any time. The non-hormonal IUD lasts about 10 years, and that's called it's a copper IUD. So you have the choice between either a Mirena, which is hormonal, or a Paragard, which is non-hormonal. Benefits from the non-hormonal IUD means that there won't be a stream of hormones that are being introduced into your system. It operates as just simply a barrier method. It's kind of T-shaped, and we insert it into the cervix. Both of them are T-shaped. Insert it into the cervix, and it blocks off. The copper actually blocks off and kills the sperm trying to enter the uterus, versus the Mirena IUD, where there's hormones that are also being released to kill off any type of sperm that may be present. So those are your options there. You can also do barrier methods such as condoms, or foams, which are less effective, or you can choose to do nothing at all and just use a pull-out method whenever you are having intercourse before ejaculation occurs. If you're not interested in any of those methods, you don't want to put hormones into the body, the other option that you have would be to do basal body temperature checks. There's something called a temp drop necklace that I'll send you the link for. You can check it out. Your basal body rate changes during ovulation. That the necklace, or they have it in bracelet form as well, monitors for any changes that may be occurring with your basal body temperature, which is indicative of ovulation. Lots of my moms use that method along with ovulation test kits. So tracking your cycle every month and doing natural family planning, you kind of get to see the pattern of your cycle, and you kind of get familiar with when your body is ovulating, because as we know, the body shows a lot of signs when it's ovulating, but sometimes ovulation can be missed. We live busy lives. We got everything happening. So there's an app that you can download, and we'll talk about how to input information in that app and keep things accurate. So those are your options. We can do a permanent surgical option. You can do an IUD, a hormonal or non-hormonal. You can choose to do oral contraceptives, which are not necessarily recommended for women over the age of 35 because of the risks associated with blood clots and abnormal fluctuation of hormones. I'm sorry, I'm losing my place. But anyway, so we have that, and then we can also do a